Good morning and welcome to the Milk Shop. All right, are we live? Okay, good morning and welcome to the Milk Bank, the Milk Shoppe Baby Café Facebook Live group. If you are new, welcome. My name is Lauren Duncan. I am the donor mother coordinator here at the Milk Bank. I'm also a certified lactation specialist, and I am a former breastfeeding mom myself. So I've been a donor, I've breastfed my kids, I've pumped, I've done it all. So I'm happy to have you all here. Today I am joined by my colleague and clinical director, Sarah Long.
Hi, welcome. I'm Sarah. I am the Director of Clinical Operations, also a IBCLC, International Board Certified Lactation Consultant, and we're thrilled to be back on after our Christmas break holidays, although we're still here working away, but this is the first one of 2021. So yeah, welcome. We're hopeful that this is going to be a good year. We've already been off to a good start in terms of our organization and all of our exciting projects and work that we have planned for the year. So yeah, it's great to see everybody.
Okay, so today we thought we would discuss the hot topic of the moment, and that is the COVID vaccine. So we know that it is becoming more available, especially to healthcare workers, some first responders, senior citizens, and then we also hope to see teachers and, especially they work with our kids. Yeah. We want to keep them safe. We want to keep our kids safe. So we're seeing it becoming more available. We're hearing of more sites becoming vaccine sites. I actually saw on the news this morning that Disneyland in California, they have not opened due to the pandemic. They've been closed since last year. They are actually going to become a vaccination site.
That's cool. So you can come with your family, and that's pretty cool.
Yeah, don't know all the ins and outs yet, but what a great way to awesome. Utilize their space and to help the greater good.
Yeah, because California's been hit hard, and of course we know here in our state, in Indiana. I know there may be other folks around the country listening today, but Indiana, we were, so far we were kind of maintaining, but we've really been hit hard lately, certainly over the holidays. So we're kind of hot off the press, a lot of the information that we're getting too. So, which is why we want to make sure we're sharing the science and the info and as much as we can with you guys as soon as we get it, because we know how important, stressful, worrying this can be. I know Lauren and I have been talking, and you can tell me, Lauren, how many moms have we had calling us about COVID period, and then now the vaccine?
Yeah, so we have had quite a lot of moms, that's for sure. Yeah. So whether if it's because they've maybe been exposed or they've tested positive, maybe they work in healthcare and work in the ICU with COVID patients. So many questions just surrounding COVID. Can they get the vaccine? And is it safe to get the vaccine while you're breastfeeding? Is it okay to get the vaccine if you are an approved milk donor? Do you need to get the vaccine in order to be a milk donor? So we get the gamut, truly, of the COVID questions on the daily. So we're hoping to, we're going to touch on those questions and then to hopefully just get that info out there and post this and to kind of ease your minds more than anything. We have fantastic news surrounding all of COVID, really, and breastfeeding and donation. Yeah. So
we can only share the science, of course. None of this is opinion. This is why we're always with anything, we're so cautious. We only want the facts and the science to be shared. It's so important for what we do, and of course the recipients being fragile babies. That's what guides everything we do in terms of our processes here at the Milk Bank and for breastfeeding moms too. So yeah, this is a great opportunity that we wanted to use this platform to address some of those questions. Again, this is just based on science. As we know, so much changes day to day. It's evolving. This has basically been the theme of, 2020. Certainly, as a healthcare professional, it was almost like day to day. Policies were changing, recommendations were changing. So obvious people are going to be confused because even we were. So we were just waiting. So, we don't ever want to share anything before we have that final say so and the science to back that. So obviously we try and field the questions as much as we can. So things change. So this is what we've got for you today. And we're excited to share some good news. So let's talk real quick about the COVID vaccine. We talked a bit about, I think everybody knows about COVID and, in terms of the health. And we know now that breastfeeding moms are still encouraged to breastfeed.
Absolutely.
Of course, to speak to your provider no matter what, but it is, deemed safe for breastfeeding. I guess the recommendations still are to use as much protection as you can whilst if you are currently infected with COVID, mask, hand washing, everything else. But for the most part, the baby is well protected. And there are some cool studies coming out now actually to say that it looks like perhaps that the immune protection can come through mom in her milk into the baby. So that's encouraging, but we shall see. It's all new. Sure. Again, there's so many studies going on right now. I mean, those scientists must be working like crazy, which is awesome because it's there to protect us and make sure we're all aware of our options and the evidence. So anyway, we're going to really talk about the vaccine because that's the biggest, the new kid on the block, if you like. So the vaccine itself is not a live virus. So a lot of people get worried about, oh my gosh, am I being injected with COVID? I get it.
Right. Am I going to get sick if I get this vaccine?
Yeah, absolutely. I mean, it's worrying, but it has been so well tested. And again, in the early days as health professionals, we were, okay, is this going to be okay? Of course, we're human too. We want to make sure we have that evidence there, and they've done a fantastic job globally, of course. As we know, there are many now on the market, but here in the United States, the approved vaccines are the Pfizer and the Moderna. They're the current two that we have here. In fact, the Moderna just rolled out late last month, and I can say that I was fortunate enough as a healthcare provider to receive that vaccine because I do a lot of front-facing in the hospital. So it was an amazing feeling. I'm very lucky, and I felt very honored, really, to be part of the folks who were accessing the vaccines. So that was an emotional day for me, certainly. And New Year's Eve it was, so it was really nice to kind of wrap up the year. So I'm awaiting my second dose, which is in a couple of weeks. So, but they're the two that are currently on the market right now that the FDA have approved for emergency use, which essentially is for folks to start getting the vaccine. And as we all know, they're trying to tier it out of the who gets it first: healthcare professionals, first responders, certain age groups, of course. So, so hopefully, we're going to see more and more of these vaccine programs roll out, which is great. So the vaccine itself, like I said, it isn't a live virus. It's essentially, in a nutshell, it's like the building blocks DNA of the virus itself. So that is essentially injected into muscle, and that then triggers for this protein to be made, which is essentially the replication of the DNA inside of the COVID vaccine. So of the COVID virus. So it makes this protein, spike protein. It kind of elicits that response just locally, and that then creates this protein, which then elicits an immune response, which is your body's way of fighting whatever comes in, infections, virus, etc., etc. So once this protein is there and it's been replicated in your muscle area, your immune response sets off that whole trigger and starts trying to fight the virus. So of course, as we know, most people in science, and this fascinates me in terms of the antibodies that are made, once you've had that experience of those cells fighting the whatever it is virus, it has a memory. So those are the antibodies that the next time you're infected, it comes in and the troops come in and start fighting.
Interesting. I've never heard it described. I mean, we know that, with antibodies, if you've, been sick or, with anything, flu virus, colds, things like that, that typically, like once you've had it, you're good, at least for a little bit, you have those natural antibodies. But I love that kind of, the analogy that you used about, like the troops coming in and saying,
next time.
Yep. No, that's
and of
great.
course it's not forever, but like Lauren said, it's like this time frame of, and again, they're still trying to figure out that part of it, but you're protected for at least a certain length of time, because your body, let's say if I got the vaccine and then a week later I was exposed to somebody with COVID, my body can say, okay, we've made these before. Here we go, send in the troops, let's fight the vaccine, let's fight the virus. So that's in a nutshell what that means. And it's part of it. And, one of my colleagues, she's a doctor who actually works with us at the Milk Bank. She explained it to me brilliantly like this. And it's fascinating to learn that this type of vaccine is quite new, but it's so reassuring that it's not actually, you're not getting COVID injected.
Getting it.
Yeah, it's not a live virus. So that's good news. It's just basically creating a localized response, and then hopefully once if you're exposed again, you'll be protected. So that then brings me on to breastfeeding. So
is it safe to get it while breastfeeding?
Wow, this is interesting. So we have had so many back and forth, and we got some good data coming through, and most of the major agencies and organizations, I would say November, December time, started coming out with their statements. So the American Academy of Obstetrics Gynecology, all of the trusted sources, from anything from pharmacology and breastfeeding to, pregnancy to, American Academy of Pediatrics, CDC, they're all starting to say, yes, it looks like that this vaccine is completely safe for breastfeeding. Now, of course, it's not been actually tested in that population yet. But because on the actual science itself of that protein and of the mechanisms, and they've done loads of tests previous years for different types of vaccines, they're saying that actually, yes, it's still completely safe for breastfeeding. However, of course, we haven't had those big trials yet with breastfeeding lactating moms. So we do always recommend that you talk to your healthcare provider.
Absolutely.
Weigh up your options. We're not here to recommend either way. It's a completely personal decision, and one you must have with your healthcare provider. But it does look good. Like I say, most of these top agencies came out saying they feel confident and reassured that receiving the vaccine, being breastfeeding, is safe. So again,
great
I know.
news. I feel like, this vaccine coming out, and then hearing, like you said, from ACOG and the Academy of Breastfeeding Medicine and things like that. That's so reassuring. They're so well respected in the breastfeeding world. Their opinions and so that's very reassuring.
It is.
I know that a lot of people have had some concerns because it did come out quickly.
Of course.
But we have incredible scientists.
Global. I mean, it's
behind right. I mean, this is not like if a vaccine came out 50 years ago. We have so much more science and research behind everything and knowledge that we have gleaned over the years from other vaccines.
Exactly.
And so I think it's just really encouraging.
Yes.
We needed some good news after just so much. So, since it seems, even though FDA has not, technically cleared it, but there are agencies saying it is presumed safe.
When they look at the actual science of the actual virus and the vaccine itself, they see no issues at this time. So that's good news. And that's what we're using the basis of all of our decisions and advice we're giving.
Yes. So with that, is it safe if you are a milk donor? Is it okay to get the vaccine?
Yep, absolutely.
That's awesome. I get calls, like I said, on the daily, multiple calls a day, asking if it is safe or if it is approved for milk donors to get the vaccine and continue donating. I also get calls asking, do I need to get vaccinated in order to donate? That answer is no. We don't require that moms get flu shot, vaccine, the COVID vaccine. That is, your choice. It's your body. It's your choice. And we do not use that as a qualifier or disqualifier for milk donation. So
we ask,
of course, especially if a donor says that she is getting the COVID vaccine, we do ask that if she does experience any side effects, to let us know, just so we can note it in her file. If she has to take any medication due to it, just to let us know. But I will say the response has been really great. Yeah. It's been really positive.
And so many of our donors are healthcare professionals.
Yes.
I get it. They're going to understand, the importance of human milk. I get it. So many of our donors, being in the healthcare field, have been asking this question, for a long time now. And that's wonderful that, we've got this, again, the backing of the science, the scientists, the professionals that are out there every day working. So that's good news that we can officially say, and that was released also by our national organization, who essentially sets our standards, very important safety standards that we have to follow. And they released that statement for us as milk banks, that it is it's a safe vaccine for milk donation. So
wonderful.
We're confident.
That is fantastic news. And then also, just to kind of expand on that a little bit, as cases are still, going up, there are still positive cases. We get the question, can I donate if I've had COVID? And the answer is yes. Again, we track medications just like you would for a standard donor. We do implement temporary holds, but that is truly mostly just to protect our depot volunteers, milk bank staff, things like that. So
and encourage quarantining.
Yes, and to encourage staying home when you are sick.
Yes.
So yes, we can take moms who have had COVID. We know now that with the cases going up, that by the end of this, there will be a large population who did have it, whether they were symptomatic or asymptomatic. So that's also really great news.
It is. And again, all of this comes down to personal choice. Of course, there's never a judgment here at all, and we're happy to answer as many questions as we can. But again, we do encourage you always have that conversation with your healthcare provider. That's very personal, for your own health, because obviously everybody's different, depending on your health status. So we definitely always, if we get those questions, we always say, please talk to your healthcare provider.
Yes, absolutely.
But if they do have the vaccine, we're good to go, which is fantastic news.
Yes, we're so happy that this is becoming a viable option for many. So I actually remembered seeing on the news this morning that here in the Indianapolis area, just north of Indy in Fishers, they are converting an old grocery store that has been, closed, shut down. It's been vacant now for a few years. They're converting that to a vaccination site as well.
That is cool.
So, we're not just seeing it out, on the West Coast. We're seeing it here in not just in Indiana, but the Indianapolis area. So that's really, really exciting.
Wow.
So, so I'm so glad that we had this time to talk about this. It's exciting to hear. I think it gives a lot of us that little ray of hope and confidence that we can kick this. And
yes,
and we have no idea how long, but I think we've We were talking in a meeting yesterday that if we've learned anything throughout this pandemic is that we truly are way more adaptable than we ever thought we were, stronger than we were. And it's really made all of us grow in ways
that was interesting
that we had no idea. So that's definitely a positive takeaway from the quarantining, from the pandemic.
That reflection was incredible yesterday. Like Lauren said, we had a staff meeting, and we took the time, which was lovely, to just reflect back on 2020 and be honest about some of the the bad parts and the challenging parts, but how we really overcame that. And I'm definitely looking at doing that in my personal life too.
Absolutely.
We're hard on each other as moms, and we know that everyone's situation is different. It's difficult with the kids being in and out of school, and obviously a lot of people out of work. So we do understand that, but it's giving yourself a little bit of grace, I think, that we have really achieved a lot. And again, we know that there are some sad stories out there. We hear of it a lot, of losing family members, and our hearts go out to everybody. But I feel like there's hope on the horizon.
There is, absolutely. So, well, thanks for joining us today. Share the information that we presented. If you have other mommy friends or family members who you have questions, you can always add them to the Milk Shoppe Facebook page. They can watch these videos. We would love to grow this community. Send questions our way as well. You can always submit them with the link with this video. You can DM the Milk Bank as well.
Private messages.
The private messages. We are happy to, if it is a pressing question that needs addressed right away, we're happy to address it right away. If not, we can always discuss it on our next Milk Shoppe Baby Café that will be in 2 weeks.
And we have our telephone number and emails, so please reach out to us. And if it is urgent, let us know, and we'll make sure we prioritize those questions. But we're here to answer as many questions as we possibly can, and I'm excited for 21.
Well, again, thanks for joining us. If you don't already, please follow us on Twitter, on Instagram. You probably already follow us on Facebook if you're watching this, but if you don't, please hit that follow button. We have lots of exciting things coming up this year that are already in the works. So keep an eye out on those social media outlets and let us know how we can help. Thanks so much.
Thank you.